Hello, welcome everyone to today's webinar presentation, Expressing Gratitude, What It Means to Patients, Family, and Healthcare. I'm Stephanie Adler-Yuan, Director of Training and Education here at the Schwartz Center for Compassionate Healthcare, and I'll be your moderator for today's session. The Schwartz Center for Compassionate Healthcare is a national leader in the movement to make compassion a vital element in every patient-caregiver interaction, and we're so glad that you've joined us here today. Before we get started with the formal presentation, I'd like to go over a few details about the webinar and how it works. The Schwartz Center's Compassion and Action webinar series is funded in part by a donation in memory of Julian and Eunice Cohen. We're so grateful for their support. Today's program will be 60 minutes long. The first 45 minutes will consist of a presentation, and then we'll have some time for question and answer with our guest speakers here today. Don't be shy. You have a questions pane on your webinar control panel, so we hope you'll take this opportunity to engage with our wonderful speakers today. Last thing to note is that today's program is being recorded, and it'll be available in the next week on the Schwartz Center website. So if you have friends, colleagues, family members who haven't been able to join us here today, we hope you'll share it with them so they can listen in later on. The last thing I'll say is that attendees are all in listen-only mode, but as I mentioned, you can interact with our speakers via that questions pane. So just send us your questions when they occur to you, and we'll get to as many as we possibly can at the end of the webinar. Last thing I'll say, this is the actual last thing, is that we love feedback. So as you exit the webinar, we'll be sending you an electronic survey, which will just take 30 seconds to complete. And we'd love to hear what you thought of today's session. So please keep an eye out for that. And now it is my absolute pleasure to introduce my colleague and our host for today's session. Dr. Beth Lown is our Chief Medical Officer here at the Schwartz Center for Compassionate Care. She's also an Associate Professor of Medicine at Harvard Medical School, and I'm pleased to welcome her here today.
Thank you, Steph, and welcome to everybody who's listening out there. We're very excited to have this webinar today, and thank you again for joining us. You may know that the Schwartz Center will host its third National Compassion and Action Healthcare Conference in Boston this June 14th through 16th. And this conference is held with the goal of convening clinicians, health system leaders, others, like our speakers today, who are committed to making compassion a priority in their organizations and in their communities. This conference has been a resounding success. We have had hundreds of healthcare thinkers, doers, leaders from across the country and around the globe sharing invaluable insights and innovation in the name of compassion. So we welcome your checking out our conference and welcoming our speakers today. Today's guests, Cynthia Sweeney and Jodi McGinley, represent in their work everything we seek to bring to healthcare here at the Schwartz Center. We are very, very grateful that they will be sharing their stories here today. Some of you may know Cynthia Sweeney as the Vice President for Nursing at the Daisy Foundation, recognized really the world over for its hospital-based programs that celebrate compassion and excellence in nursing. Cindy's also a dear friend and has been on our advisory committee for our conference since its inception. Cindy will talk with us today about exactly why meaningful recognition and gratitude really matter so much to patients, families, caregivers, and share the results of a recent study that examined this question. Jodi McGinley is a parent partner at Arkansas Children's Hospital, and Arkansas Children's, in fact, is one of our Schwartz Center member hospitals. And most importantly, maybe she's a mom, and she joined Cindy to bring this work, their work, the idea of meaningful recognition to life by sharing her own journey of loss and gratitude. Welcome, Cindy and Jodi. So let's turn the program over to you now, and let's just begin this wonderful webinar.
Well, thank you, Beth, for the introduction. It's truly a pleasure to be with you today and to be able to present with Jody. So you'll hear her story of gratitude later in our presentation. Jody's story supports the evidence of the impact of gratitude and its healing grace. So in this presentation, if we can go to the next slide, we will be defining meaningful recognition as it relates to healthcare, examining the evidence that supports the importance and impact of using meaningful recognition, and what it means to patients and families to express gratitude based on current research. Next slide. So let's start with the story of gratitude, which is the story of the Daisy Foundation. The Barnes family experienced a tremendous loss when Pat, who was a son, a husband, and a father, left this life too soon at the age of 33 due to complications of an autoimmune disease known as idiopathic thrombocytopenia purpura. He and his wife Tina had just welcomed their baby daughter Riley 6 weeks prior to his diagnosis. But soon after the diagnosis, Pat was admitted to the ICU. What was not expected was his passing 8 weeks later, which left the family asking why and how could they move forward with this tremendous sense of loss. As they recalled their experience and shared stories, they realized that their best and most positive stories were related to the compassionate nursing care that Pat and they received. So they decided to go back and say thank you to the nurses who had cared for Pat and for them in that 8 weeks. From that experience of saying thank you, they saw the power of gratitude and dedicated themselves to having a means to recognize and honor compassionate, extraordinary nursing care. The Daisy Award was born of that desire to say thank you. Tina, Pat's wife, created the acronym DAISY, which stands for Diseases Attacking the Immune System, so that Pat and their experience would always be remembered in this work and why it came to be. Next slide. For 20 years, DAISY has been honoring extraordinary nurses around the world. There are now over 4,000 healthcare organizations and schools of nursing who are DAISY partners. We're delighted to have honored over 136,000 nurses with the DAISY Award. The number that really astounds us is that 1.6 million times a patient or a patient's family or colleague has taken the time to thank a nurse and write a nomination. This desire to say thank you is worldwide, with 25 countries outside of the US using DAISY to express gratitude for nursing care. Next slide. The DAISY Foundation provides a means to express gratitude to nurses through our programs that recognize them for the extraordinary, compassionate, skillful care they provide each day. By honoring compassionate practices in nursing care, DAISY reinforces the important role that compassion has in our healthcare delivery. Next slide. So this beautiful program that was created, this program of gratitude, is timely, as many of my own nursing colleagues and other providers of care struggle with the volatility, the uncertainty, the complexity, and the ambiguity that we see in the healthcare setting today. All of these pieces combined is creating an atmosphere for burnout to thrive. So what can we do about it? Next slide. In the healthcare setting, the Institute for Healthcare Improvement challenged us in 2007 with the triple aim of improving population health, of increasing patient satisfaction, and reducing healthcare spending. But it was soon realized that to attain these targets of the triple aim, we needed the provider resources to do so. Hence, the fourth aim was added, acknowledging that clinician and staff have to be considered a target for our success. Next slide. How do we improve the professional satisfaction of nurses and other healthcare providers? Well, first we have to understand the issues and we have to collect the data to mark our progress. Compassion fatigue and compassion satisfaction have been identified in the literature as conditions experienced by providers of care that can impact the quality of care delivery. The ProQual, which is short for professional quality of life, is a commonly used measure of compassion fatigue and compassion satisfaction. Compassion fatigue is seen in this graphic as comprised of burnout and secondary trauma. As healthcare providers, our professional life is made up of both compassion satisfaction and compassion fatigue. The challenge is to keep it in balance and avoid compassion fatigue as the carrier of the greater weight in our professional lives. If compassion fatigue outweighs our compassion satisfaction, the consequences will negatively impact care. What are those negative impacts? Next slide. According to research, the consequences of compassion fatigue can be seen here on the slide. Emotional distress, safety risks, apathy, loss of empathy, work days lost, a desire to quit, and poor judgment. None of these is desirable in a patient care setting. In healthcare, we're often taught to focus on what's not right when it comes to our patients: the aberrant blood pressure, the medication error, the lack of staffing, etc. But what if we focused on what is right? When an organization's focus expands to include what's right in care delivery, the balance can shift. Next slide. When compassion fatigue is mitigated and the focus is on the positive, individuals feel an increase in caring, contributions to the work. They experience more energized moments, which can fuel creativity and innovation, and ultimately, with these in play, an outcome of increased patient satisfaction can occur. Next slide. In research conducted by Dr. Leslie Kelly and Cindy Lefton, they investigated the attributes of compassion satisfaction. They wanted to identify what contributed to compassion satisfaction and what restored the emotional energy of ICU nurses in 24 hospitals across the U.S. They conducted interviews with the ICU nurses, asking them what restored their emotional energy, allowing them to care for the sickest and most vulnerable patient populations each day. In the ICU nurses' responses, 4 themes emerged. Positive feedback. The times you get thanked stand out in your mind. Clinical outcomes. Seeing a patient get better right before my eyes. Quality teamwork. Knowing the people I work with have my back. And increasing one's self-awareness, recognizing that I'm affecting you more than I even realized. Next slide. The American Association of Critical Care Nurses identified the importance of creating and sustaining healthy work environments in an effort to retain ICU nurses in this specialty. Their early work in the 1990s led to the identification of the components of a healthy work environment, establishing standards in 2005, and then a revalidation of the importance of these components in 2017. The creation of healthy work environments is imperative to ensure patient safety, enhance staff recruitment and retention, and maintain an organization's financial viability. The 6 components of a healthy work environment include skilled communication, effective decision-making, true collaboration, appropriate staffing, authentic leadership, and my favorite, meaningful recognition. Next slide. Let's focus on the component of meaningful recognition. There are all kinds of recognition for nurses, but that which is meaningful to the individual is what matters most. In the center picture, a nurse approached me at a conference not too long ago and was so very proud of receiving the Daisy Award at his hospital. But he was even more proud of the number of times he had received a nomination for the Daisy Award, as he felt that this was the most powerful recognition that he could get, that he had made a difference in the lives of so many people. He had numerous Daisy nomination pins displayed on his hospital name badge as an affirmation that he made a difference each day. Next slide. So what is meaningful recognition? It's defined by Dr. Lefton as a powerful form of positive feedback. It acknowledges how a person's actions have affected another, and it is relevant to the recipient as well as equivalent to their contribution. Next slide. This model indicates the Daisy Award's impact as a form of meaningful recognition. And we know that meaningful recognition in Daisy can impact an organization in three areas. As a component of a healthy work environment, it celebrates all that's right in an organization, and it reminds nurses of why they came into this profession. This leads to nurse engagement, articulating best practices in compassionate care and providing feedback as to how they make a difference in the lives of others, which then leads to a better patient and family experience, while providing a means for gratitude for compassionate care to be expressed and shared. Next slide. Now let's take what we have learned in this presentation so far and see what it looks like in the lives of patients and their families. So at this point, it's my pleasure to turn this presentation over to Jodi McGinley, who will share her family's Daisy story of gratitude and compassionate care. Thank you, Jodi.
Thank you, Cynthia. I'm honored to be here discussing an area that I'm so passionate about, and that is compassionate care and meaningful recognition. Arkansas Children's Hospital is where I am currently serving as their parent partner, or in more simpler terms, I am their parent on staff. I'm here to share with you our own personal story that ignited my passion for compassionate care, patient and family-centered care, and meaningful recognition of healthcare providers, teams, and employees. Next slide. After years of miscarriage, infertility treatments, and a lot of sleepless nights, my husband Jesse and I became pregnant with twins. And I will tell you that there is nothing more terrifying to new expectant parents, especially ones who have been through multiple miscarriages, than to be told you are now expecting twins. And during our 20-week ultrasound, our high-risk specialist explained to us that our baby A looked to have had a neural tube defect, otherwise known as spina bifida, and that baby B looked to be healthy. Now, I'm a teacher by degree who was at that time working with special needs children in the healthcare setting, and the thought of our son, who we would name Eli, being special needs brought me to a place of comfort because I knew that no one would love him or care for him more than I would. My husband, an electrical engineer, on the other hand, was so terrified, and there was a sense of loss about this being out of his control. And we'll fast forward just a bit. 14 weeks of bed rest later, we delivered our twin boys, Eli and Walker, at 36 weeks gestation. Walker remained at the University of Arkansas for Medical Sciences, which we refer to it here in Arkansas as UAMS, and Eli would be transported to Arkansas Children's Hospital to be cared for by their very own spina bifida team. And it is at this point that Eli's health began to deteriorate. His prognosis became grim, and by the end of that week, with the direct and honest and very brave support of a special nurse practitioner, her name is Nurse Sabra, we made the excruciating decision to remove Eli from life support and allow him to become a neonatal heart valve donor so that other babies could live. Next slide. Jesse and I had scheduled Eli's baby dedication with our pastor. It was something that we had planned to do when we brought the boys home, but with the unexpected news and the time, we did it here at Arkansas Children's Hospital with our family and our close friends. And that same evening, he was scheduled to be removed off of support. So once everyone had a chance to hold him and his baby dedication was over, we had our family and friends leave the room. Eli's neonatology team explained to my husband and I just to expect a few minutes with Eli once he was extubated. And unexpectedly, Eli continued breathing on his own for several more minutes, which would turn into all night and through the next day. He breathed on his own for 31 more hours. It is situations like this in healthcare that are so very unexpected. And what do you do? Next slide. During those crucial 31 hours, a large part of this experience for us was the experience that we had with our nurses who were assigned to our twin boys. One nurse, a veteran NICU nurse with many years of NICU experience, Nurse Laura there to the left in the pink scrubs. She was the nurse assigned to Walker at UAMS that particular day. And Nurse Lindsay with Arkansas Children's was the nurse who clocked in for her night shift and was assigned this family, this end-of-life comfort care case that turned into a 31-hour crisis. Nurse Lindsay was roughly 2.5 years out of nursing school, and these two nurses at two different institutions would have normally never crossed paths. And between these two healthcare systems and these two little boys, what would transpire would change our lives forever. Our family was extended a partnership with these two nurses during our darkest hours, most traumatic hours, and it was a beautiful beginning to a lifelong friendship. Next slide. That next day, both the Arkansas Children's and UAMS teams partnered in what would be a non-traditional and very unprecedented move. They were very intent and worked quickly to have the twins reunited. Within 58 minutes of that idea, Eli was transported by the Arkansas Children's Angel One team directly into Walker's NICU room at UAMS. And behind the Angel One transporters was my husband, along with Nurse Lindsay from Arkansas Children's. And behind them was a host of NICU doctors and nurses. And I remember being so relieved to see my husband. And this is a moment in time that I wish I could actually physically encase into a bottle, because I remember it so vividly. So many years later, I remember seeing tissues flying and nurses putting their arms around each other. And the flow of what was going on was very quick. And knowing time was of the essence for Eli and our family, as I opened Eli's isolette from Angel One, and as they opened Walker's isolette there in the UAMS NICU room, they placed Eli inside of his twin brother's isolette. And this would be the first time that the boys would actually have touch since being in utero. And one of the nurses placed Eli's arm on Walker's shoulder, as you can see in the photo to the left. And Eli's color began to turn pink again. He was very gray in color from his stats dropping all night long. And from that moment, his color began to come back. And the power of twins was very evident in that moment for all of us. And there was a nurse in the room that had happened to see my camera lying on top of my luggage. Every new mother has that new camera ready, and unfortunately, we had not used our camera to that point that week due to the unforeseen spiraling turn of events that were really out of our control all week long. And thanks to this nurse and her actions, we will forever have these photos that you see on your screen. The family photo that you see to your right will be the only family photo that we will ever have for the rest of our lives. And these are the things that they don't teach you in nursing school, but these are perfect examples of what compassionate care or patient and family-centered care look like. Compassionate care is not taught in school. You cannot find it in a medical book, but it is within each one of us. The remainder of that afternoon was so beautiful. We were in Walker's NICU room, the four of us. It was Jesse, myself, it was our twin boys, Walker and Eli, and we held him, we sang to him, we talked to him. We were never left by Nurse Lindsay and Nurse Laura. These two nurses allowed us to shut our eyes to take a cat nap while they kept a close eye on Eli's condition so that we didn't miss his last breath. That was one of our greatest fears during that moment. And granted, we hadn't slept in days at that point, and I was still recovering from a major C-section and was not taking my medications because of this terrible situation that we were in. And they were making sure that we were eating, something so simple that was so impactful that I'm able to share with you today. Nurse Lindsay at this point was even off the clock for Arkansas Children's and had spent what normally would be her sleeping time at home, but she spent it in the recliner in this UAMS NICU room with us. She wanted to see to it that her patient passed on from this life with dignity and care. Nurse Laura had welcomed Lindsay into her territory, so to speak, into that room all day and all night, and I recognized that they had a shared compassion and interest and love and respect for this unique situation. And I remember at one point looking up, and they were actually working on the boys together, from nurse to nurse to their own patients. And it was a really beautiful scene to where a nurse could have really been territorial and could have, said, I don't need any help. But these two nurses did this so well. Eli would pass away in our arms around 1:30 that next morning, all thanks to these two nurses. And we were a family of four in that room with our two nurses until his final breath. There was not a procedure, a medication, a surgery that could have possibly have saved our son's life. He died of a major unexpected birth defect. But what mattered in this instance and would resonate with us for the remainder of our lives is how they would make us feel during those 31 unexpected hours that we had with Eli. Next slide. Something that I love to share during our new employee orientation classes here at Arkansas Children's Hospital is that the word family is defined by that patient and family member. And today I'm here to share with you that although it is not a picture perfect situation for my family, if you were to ask me today what my family looked like, I would tell you that I'm a mother to four perfectly and beautifully made children. 3 of whom are actually here with us on Earth. And I am the donor mom to a little girl in the state of Maine who received Eli's aortic valve, whom we talk with weekly. We share our lives with them. In fact, our families make yearly trips back and forth from Arkansas to Maine. And I'm the donor mom to a little boy in the Dominican Republic who was born with a hole in his heart and received Eli's pulmonary valve as a bicuspid onlay patch for that hole. My son's gift of life has redefined what our family looks like, and he lives in these 2 children across the world. Next slide. Today, we are blessed to say that Walker is a NICU graduate and is a healthy 10-year-old little boy. I'll jokingly tell this during trainings that raising him is equivalent to raising an 83-year-old man, because this child loves coffee each morning. He loves the History Channel. He loves news. He loves Werther's Original Candy over any type of kid candy you could possibly offer this child at any gas station or store. He has been an amazing child to raise. And on the 1-year anniversary of Eli's death, I'll share that I was not feeling well, and I attributed it to what I thought was the weight of grief. Because if you've ever lost anyone that's really close to you, as a child, or maybe you lost a parent or someone that you just love so much, it's very heavy. And that particular day, I was feeling that heaviness, and I was also feeling very ill. And that day was spent with Nurse Laura. It was spent with Nurse Lindsay, and of course, Jesse and I, and baby Walker at the time. And we had dinner, and we reflected on what the past year has meant to all of us. And after dinner, it ended up being a surprising discovery that we were actually expecting another child that very day. On the first anniversary of his death, out of all dates, how could that be? But exactly 9 months to that day, we delivered their little sister Ellie, who you see there in the center, and with the same team of doctors and nurses who came back into the delivery service that day to see to it that she arrived safely. And it was there that I truly realized they needed closure too. There was closure and healing in this process, not just for us as a family, but for our healthcare team as well. And Charlie Kate, she's our baby. She's the one there on the end. She's 4 years old and is constantly asking questions about the brother that she never knew. Our new normal also includes the relationships that we will forever have with these nurses and neonatologists that change the scope of our story. They have been an active part of our family, watching our children grow. They attend events. We have relationships with this team, and my husband and I cannot imagine anything any differently. The connection that Walker has, in particular with Nurse Laura and Nurse Lindsay, is breathtaking. He lights up when he sees them. And just recently, Nurse Laura had the opportunity to sit down with Walker with his and Eli's baby book of photos and talk to him about her perspective on the events that took place the week of their lives. And I have dreamed as a mother for that moment for over 10 years now, and it brought tears to all of our eyes to hear her words to the little guy that she helped save. Next slide. You see, compassionate care and patient and family-centered care is not just a slang term thrown around the healthcare setting, and these are actual acts of compassion. It can be inconvenient. It can be heart-wrenching at times. It's uncomfortable, but ultimately it's just the right thing to do. Next slide. When families experience loss, we don't have the capability to bring our trophy or our healthy child or pride and joy back to the very nurses and healthcare staff over the years as they grow. You see these social media posts like that often, where a child reunites with a nurse or the doctor that saved their life. And unfortunately, families of loss are left with these pieces that have been handed back to us to try and make a life out of. And for Jesse and I and numerous other patients and families that I've had the privilege to speak with over the years, the common denominator that I hear is that it is important for us to be able to give these individuals, our nurses, that recognition piece, that gratitude, that thank you that we cannot give them in the form of our children and their growth and their presence, but in the form of an intangible nomination or recognition. Because it's all that we have to give is a simple thank you. It's like a diploma. Once earned, you can never take it back. And for me, I had hoped early on that maybe they wouldn't forget my son. But what I didn't know was that these nurses would very much be a part of our lives and for our family forever. And today at Arkansas Children's, as their parent on staff, I have the privilege of sharing our family story throughout the facility during new hire orientation and medical student trainings, resident conferences, and I also have the opportunity to sit with leadership teams there to give a parent's perspective on the decision making for Arkansas Children's system. And one of the highlights for me is working directly with our family advisors for the hospital and getting to know their family stories. You know, what's their drive? What is their why? And I will tell you that a large majority of these advisors believe in meaningful recognition in their way to give back to their medical teams as well. Having been an advisor for the past 10 years and a public speaker on this for the past 8, our family feels so passionately about compassionate care that we even had decided to team up with the patient experience team at UAMS a few years ago as we founded the Eli Award, Excellence in Patient and Family-Centered Care. And we were just that committed to meaningful recognition. You hear the saying, you may not remember their name, but you will never forget how they made you feel. And as a patient and family member who recognizes the importance of meaningful recognition, it is my desire to empower everyone I come in contact with, statewide or nationwide, the power of a thank you and just how much that means on both ends of the stories. And I'll turn this back over to Cynthia Sweeney with the Daisy Foundation.
Wow, thank you, Jody. And I've heard your story before, but every time I hear it again, I get goosebumps, and it's just an amazing story of fortitude, of bravery, of care. I mean, I just want to thank you again for sharing such a personal glimpse of your family's life over these last 10 years. So through Jody's story, you can see the power of gratitude. What we as nurses consider as ordinary is extraordinary to our patients and families when delivered within a framework of compassion. Gratitude contributes to compassion satisfaction, and recognition articulates the compassionate practices that we value, which fuels an environment of excellence for patient care. We know expressions of gratitude and recognition of compassionate nursing care is important to nurses. But what does it mean to our patients and families? Next slide. We at the Daisy Foundation wanted to investigate what it means to patients and families, as we felt that we understood it anecdotally. I was fortunate to be a part of a research team that asked this question: what does it mean to our patients and families to be able to express their gratitude for compassionate and extraordinary care? Next slide. An IRB-approved research study was conducted at a large 8-hospital healthcare system to ask this question: what does it mean to patients and families to be able to express their gratitude for their care? Through structured interviews and a sentiment analysis of this qualitative data, 3 distinct themes emerged. The first was describing what was extraordinary about the care, what the characteristics of their nurse were that made them so special. The second was synergy of the human connection, describing this relationship that was mutual, being able to be an equal partner in care by recognizing their nurse for the care they provided. And the last, gratitude that transcends the moment. This gratitude that moves into the future and takes us beyond. These themes can be identified in Jody's story, just as we found with other stories of care in this research. This research was just published this month in AONL's The Nurse Leader, and the citation is in our references at the end of the presentation for your citation ability to reference it. Next slide. Jody shares in her story the incredible attributes of Laura and Lindsay that made them so very special to their family during a very critical time. The theme of compassion is expressed over and over, as well as the dedication that these nurses had for Eli and Walker, as well as for Jody and Jesse. They were experiencing extraordinary care in this theme. Next slide. Synergy of the human connection. There is not any doubt in Jody's story that there was a powerful human connection made. The family and the nurses continue to stay in touch. It's important to Jody and Jesse that they be able to meaningfully recognize the care that Laura and Lindsay and others provided. Thanking them through their Daisy nomination articulated the importance of the care and honored the relationship that they shared. It provided this family with a means to express their gratitude and what they valued in the care. Next slide. Gratitude that transcends the moment. No doubt that the pebble in this ocean of gratitude continues to ripple, as demonstrated by the generosity of Eli's organ donation, the establishment of an award in Eli's honor, and the role that Jody has in sharing her story to new healthcare providers to better prepare them to provide care to others. Truly a sense of loyalty to the two organizations and to the people involved in this entire journey of healing and gratitude. Next slide. How do we take what we have learned from stories like the McGinley families and from the research and apply it to practice? If you have the Daisy Award in place, think of those nominations for the award as rich, qualitative data. This data is telling you, as healthcare leaders, what's important in healthcare to your patients and their families. In our study, we identified nursing behaviors that can improve the connection between the nurse, the patient, the family, and the organization. The data also told us of patient and family-centered nursing actions that were important. And if we distill these behaviors and actions into nurse competencies, we may be able to further improve the patient and family experience. One important takeaway is that these stories of care must be honored as a means for healing, not only physically, but also emotionally, allowing a chapter to close in order to move forward, not forgetting, but to look to the future. And lastly, but most importantly, when we validate these stories as meaningful recognition, we communicate that the patient and family voice does matter. Next slide. In closing, this quote from William Faulkner sums it up. Gratitude is a quality similar to electricity. It must be produced and discharged and used up in order to exist at all. Next slide. This picture of Walker and Camberry provide a happy ending to the presentation. And at this point, I'd like to turn the program over to Beth for our question and answer session.
Well, first I just have to thank you both. The story, Jody, honestly, I think I'm just still just so moved and tearful listening to you. It is just a poignant, everlasting story of connection and compassion, and I would say love, which is really transcendent. So thank you, and thank you, Cindy, for presenting the information about the Daisy Award and this research. I can't wait to read that article, so we'll look forward to it. We do have a few questions that we can pose to you from folks in the audience. I think that some people are really interested in the study that you did, Cindy. I don't know if you want to elaborate any more on it. Were there any particular, it was a qualitative study, were there any other particular findings that stood out for you beyond the themes, or any way that you make sense of this, of the key themes that emerged from this study?
Well, I think that the study, and of course, when you get into an interview, and these were structured interviews that were designed to go 15 to 20 minutes, and they often went to 30 because the patients and families who participated, they really wanted to share their story. They just wanted everyone to know what the care meant to them. And one of the pieces that came out that not part of the themes, but just as an aside, was how important it was for them to know whether or not their nurse received the Daisy Award. That was an aha moment, or that the nomination was even received at all. So one of the members of our team, Dr. Susan Grant, she's the chief nurse executive at the hospital system, she took that for action immediately. She realized that sometimes these nominations, you know, they don't necessarily always get acknowledged because they're anonymous. So they made an opportunity for patients and families to click off a box and say, would you like to know basically the status of your nomination? So that they had that feedback that truly when they took the time to write these nominations, that information was shared and that people received it. So, you know, communication is two-way, right? There's the message that's given and the message is received. So that was something that came out as an aside. And I think the other piece that we weren't expecting, which is enveloped in that third theme, was a sense of loyalty to the organization. There was one patient that shared that she'd been brought to that hospital because of she was in a car accident, so she was taken to the closest hospital. And as a result of the care that she received there, she said whenever she has a choice, even though that hospital is an hour away from her home, much further, she will always go to that hospital.
Mm.
So I think that there's some really tremendous lessons to be learned, and that the data that we get through these nominations and feedback, we really need to take the time to look at them and not just say, oh, this is great, that's a nomination for a recognition, present it to the individual and then be done with it. It really has impact for the organization if we take the time to appreciate it.
Well, it has important lessons. It has very, very important lessons about what's important to families and patients, but also what's important to the staff and the folks who are serving those patients and families. So, I think it's a lesson to the leadership. The more you can enable those acts, the more meaningful people will find their work, that is really why people come to healthcare. People come to healthcare to service. When that urge and motivation is impeded, that people start to experience this, burnout or compassion fatigue that you talked about earlier.
Well, and I think Jodi's story of the two nurses, I mean, just think what it took for those two hospitals for the one hospital to allow their nurse to go to the other hospital. They're not even the same system, completely different organizations. And then to allow that other organization to receive that nurse and allow that care to be provided. And then what it meant to those nurses to be able to have that closure, that connection to those babies without physical obstacles in the way of what was truly emotionally important, not only to the parents, but also to the nurses.
Yes, absolutely. It's interesting, too, when we hear stories of remarkable care, there is something just so resonant with your themes, Cindy, that there are people who just go above and beyond. And, that's, I think, the meaning of the extraordinariness of the care that's rendered. They just, there's something about being, it's not really even altruism. I use the word love, and I know we don't like to use that word so much in medicine for some reason, but that's really
why? Why?
It's exactly what it is, right? Well, let me return to some of these questions. I'm kind of hogging the time here.
Sure. And I will say that we would love to replicate that study to see if it's validated in other systems. So if anyone's interested in that, please feel free to contact me directly.
Yeah, absolutely. There's a really interesting question here from a participant, a listener, saying, thank you so much. How do you give compassionate care while maintaining professional boundaries? Do you want to address that? Both of you, actually. Cindy, do you want to go first, and then Jody?
Well, I think that as a professional, you define your own practice, right? If you are doing things in the right lane and you're doing it for the right reason and the right focus, I mean, look at those two nurses again. They crossed over what would have been considered, a barrier that they shouldn't. They practiced in a setting that maybe they weren't credentialed in. Let's just say that. But their compassion, I mean, do you get credentialed for compassion? They were able to practice compassion and nobody stopped them. So I think it all goes to what you define as your own professional practice model, and understanding that there are limits, there are guides for us, but we also have to be willing to test those boundaries, right? To see how far they go, because sometimes we inflict our own boundaries on ourselves.
Yes, absolutely. It's also interesting, in Ken Schwartz's story, we have his story up on our website, he mentions this point. He mentions that one of his caregivers contacted him outside of sort of the confines of the usual, clinical encounter, and he commented on, maybe it's time to rewrite the rules about these professional boundaries. Jody, did you want to comment on this as well? About professional boundaries and how do you maintain those, or what is that all about?
Sure. I mean, I can really only give you this from a patient and family's objective. I will tell you that it helped our healing process to know that our teams were emotionally involved. So, I do agree with Cindy that you kind of have to test those boundaries, and I know that every family situation looks differently. I think for us, we're just extremely blessed that we were placed with the right nurses and the right team members at the right time. I do believe that boundaries sometimes do need to be set with your patients and family members, but you as a healthcare provider, I know that you will connect with different families differently, and it's going to look differently for everyone. But as far as our situation, it was helpful, and I can't imagine not having those relationships with this team that we had. They are essentially the reason why I'm on this webinar today. They've changed our lives, and it's really changed my career path as well.
Yes. Can you say a little bit more about the parent partner program that you're involved in, Jody?
Absolutely. So nationwide, there is a trend of bringing on patients and family members to I'll use pediatric hospitals as an example. There's a trend across the country of bringing a patient and family member on staff to be able to give that feedback and just be able to partner with someone that's actually been through the system with their own children. And Arkansas Children's a couple years back decided, you know what, we want to be a part of that. We want to better our patient experience and bring an actual parent to the table. And that's where this position comes in. And it's an honor to be able to serve in that manner, to be accessible to this hospital system, but also be able to work with our patient family advisors. And that's been just the jewel of this entire experience, is to get to know them.
That's wonderful. So where do you see, Cindy, where is Daisy going now? What's the future? I know you're now all over the world. So I'm not sure there's, aside from outer space, but
well, there you go. There's new frontiers all the time.
Yeah, exactly. But it sounds like you're interested in more research. And what other thoughts do you have about how everybody really can move this effort forward of sustaining compassion, promoting connection at a time when I feel that it's really being made increasingly difficult with the demands for productivity, limits on time being, spent with patients and their families. It's just so much external pressures with, I'd say the commodification of healthcare in general. So how do you see us, working together, all of us, to push this and sustain it as just essential?
I think that, what's happened that we've experienced, obviously, is that the time is right. I mean, people are thirsty, they're hungry for bringing back the basics into healthcare practices. Just like we brought back plain old hand washing, right? We were able to get that put back in. We don't do anything super duper fancy with that. It's a matter of washing your hands.
Right.
The same thing, I think it's a matter of really being conscious of how we deliver the care. Do we deliver care with dirty hands? No, we wash our hands now. Do we deliver care with compassion? I think the time is right. And I think that as providers, we want this to happen. And so we've got a lot more in our collective voice than we realize. One thing that I continue to be amazed at is, this is how Daisy has just spread. As you can see, we don't have any great big commercials on TV every night. It wasn't on the Super Bowl, right? But yet it is virally being communicated, hospital to hospital, chief nurse to chief nurse, physician to nurse. I mean, whatever it takes, people are taking it and moving it into different settings. And, Daisy goes wherever nurses practice. And we find too that it's a global, I want to call it a global movement, because it doesn't know any cultural boundaries. Daisy is thriving in first world and third world. It's something that just needs to happen. Everybody recognizes that. So we know it needs to happen, but how do we make it happen? I think the other piece of this is we need to be very cognizant of our policies. We just talked about testing the boundaries, right? We need to question why we have the boundaries. We need to start thinking and talking about compassion as part of our policy initiatives, that we should be very, very mindful of what we do and how we do it, and do it within a framework of compassion, not as a sidecar, but as a embedded practice, as the tapestry of how care is delivered. So I think that it's starting to come together. It's, as I like to say with my military background, it takes 5 miles to turn an aircraft carrier, so it's going to take some time to turn healthcare. But I think with everyone moving in the same direction and in the right direction, it's possible. Anything is possible. So, I mean, that's my 2 or 3 cents worth. But I think once we verbalize and let people know that this is important, we need to get involved in politics. We need to be there at the front lines, making sure our voices are heard.
Excuse me, I totally agree, and I think it's important to think about partnerships in doing this work. Your comments really resonate because it's very similar to Schwartz rounds. We've never really advertised Schwartz rounds, but they have spread because they answer a specific need. So we do, too, also recognize the importance of recognition. And I do want to mention, actually, that we also will be opening nominations for our National Compassionate Caregiver of the Year Award very shortly for the Schwartz Center. So I think between the two organizations to really build the momentum around the importance of meaningful recognition, I think that's going to be a really important driver. I have just a couple of more questions if you folks want to take a listen to them. One is, this is really kind of interesting. One person is wondering about whether Daisy winners stay in touch with each other, and how you network people together.
So do you mean in general for the Daisy organization or for Jody's Daisy nurses?
No, the Daisy winners, the organization.
The Daisy recipients?
Yeah.
I think we don't make a conscious effort necessarily, like connecting people. They certainly can find each other up on our website, Daisy Nurses. There's, all the stories of Daisy nurses who are registered with the Daisy Foundation, so you can find each other within your state. One of the things we're starting to look at is doing a regional event where we bring nurses together, Daisy nurses together, and share best practices. The other thing that we have been doing for the past 5 years, going on 6 now, is we do a Daisy breakfast at the Magnet Conference, and that breakfast is intended to honor our Daisy nurses and the Daisy organizations. So that's another opportunity to gather Daisy nurses together. And we also have an ambassador program. We have sort of informal, formal ways to do it. But if anyone's interested in connecting up with other Daisy nurses, please feel free to use my email and contact us, because maybe it's a time that has come.
Yeah, and do want to mention too, Cindy, that you're hopefully going to be at the conference and available for questions also in June here in Boston. So I think maybe we have time for one more question here, and this is, again, it's a broad question, it's a deep question, but we can just take a stab at it. What are the principles of compassion that you embed in practice? What are the nurse behaviors that you identify as compassionate behavior? I think in terms of the competencies you were mentioning.
Mm-hmm. So it was really very interesting to us when we did these interviews that no matter how structured our interview was, one of the things that the patients' families wanted to stay on is describing their nurse, describing the attributes of their nurse. And these weren't, super high level attributes, right? This was things, like I said, earlier in this presentation, it's things we take for granted as providers or as nurses, that what we do ordinarily is considered to be extraordinary. So things like she was kind, he smiled at me, he held my hand, he gave me a warm blanket and stayed with me. It was very positive, never complained, things like that. So those were these characteristics that, again, we would just say, well, that should come with the territory when you're taking care of patients. But the fact that the patients and families dwelled on this meant that there was something unique about that particular nurse, different from the other nurses who could have been just as pleasant, but maybe not to the point that it touched the soul of that patient. So there's a person that comes in and smiles at you and walks right back out the room, and there's a person that comes in, sits down, holds your hand and strokes it and smiles at you. So looking at what those sort of anecdotal descriptions are of those characteristics, and then if you see these themes of characteristics come through, then those are things you can point to when you're teaching new nurses or physicians or whoever, and say, these were the attributes, these were the characteristics that patients saw that they really like. So take that extra moment and come all the way into the room, sit down with the patient, hold their hand, offer them the warm blanket, offer their family member, as you heard Jody say, they took care of feeding us, because sometimes patients and their families forget to feed themselves. So going that extra little bit that, again, we think is ordinary is extremely extraordinary. So if you take those and you think of those actions, that what the nurses did in some of these testimonies, and then you put that together, I'm not saying we've done it, but I'm saying a smart hospital might start to think about developing some competencies around compassionate care.
It's those small acts of kindness, right? It's almost beyond competencies in a way, because it doesn't capture the depth of emotion,
right,
and connection, that's really exhibited. It is bringing people to their true selves. And I think it's important to stress diminishing the barriers to the expression of this kind of compassion.
And I think we're all capable of the compassionate element, but we're not aware, we're not conscious of it. So I was doing some work with operating room staff, and we did some competency development in terms of just looking at your few minutes that you have with that patient. What were some opportunities for you to communicate to them your sense of compassion and empathy for their situation? So things like that. So having, allowing people to stand back and have sort of that self-awareness of my actions and how I can make it better.
Well, thank you both. So I think we are going to have to put this webinar and draw it to a close and put it up on our website so that others can listen to it later on. It's so amazing to me that both Daisy and the Schwartz Center grew out of patients' stories and patients' recognition of what was important to them. We just have so much synergy. So I want to thank both of you, Cindy, Jody, for your wonderful contributions, for your stories, for sharing yourselves. And I will turn this back over to Stephanie to close us out.
Great. Thank you so much, Beth. And thanks so much, Cindy and Jody. What a memorable hour this has been. We're so grateful that you've shared your stories and your experiences with us. And for our participants on the line today, if we didn't get to your questions, I'm so sorry. There were so many wonderful questions. I will say that some of you asked about how we bring practices like gratitude and thinking about compassion to our leadership. And I have to say, I encourage you to join us for our Compassion in Action webinar, conference in June, because that is really what it's all about, all the ways in which we can bring compassion to our workplaces, for ourselves, for our patients, for our families, for our leadership, for the broader community. So there's lots of information about that on our website at theschwartzcenter.org. And with that, I'll just say that I really hope you enjoyed this webinar today. I certainly did. Thanks again to our speakers. Thank you, Beth, for your wonderful moderation. And I will just remind everyone to please fill out the survey that'll come your way, and feel free to share this webinar once it's on our website after you leave us. So thanks again, everyone. Hope to see you again soon.